Good morning, everybody. I am Anita Krishnan, Head of Analytical Sciences in Biocon Biologics R&D. I'm responsible for the analytical strategy pertaining to a portfolio of MABs, insulins, and other recombinant therapeutics. Prior to this role, while I was a project group leader in Chennai, I kickstarted Biocon's R&D Center, which is also my WomenLift Health project. Biosimilars are highly similar versions of approved and authorized biological medicines. More than 3 million patients in India benefit through Biocon's biosimilars, and our current global product footprint is about 85 countries. Biocon has exceptional scientific talent and world-class R&D infrastructure. Launching a new R&D site at Ticel BioPark in Chennai was in line with the vision of R&D. I joined Biocon in May of 2020 as a seasoned R&D professional with loads of product development experience. When I entered Chennai facility, I was thrilled to see extensive lab space on 2 floors overlooking the Bay of Bengal. I realized that I was the senior-most professional on site, and there was so much more that I can contribute to make this a great place to work. I rolled up my sleeves to chalk out a plan. There were 3 pillars of work elements. As you see, infrastructure, people, and projects, and the cartoon here depicts the way they exactly happened. To start with, there was a whole lot of infrastructure details to be attended to, too few people, and there was no science for the scientist. It seemed like an uphill task with very slow progress. Around this time came in the WomenLift Health Leadership Program that invigorated me inside out. The entire infrastructure piece happened through COVID lockdowns, adding more complexity to the prevailing situation. The administrative and engineering staff were located in the main site in Bangalore. They were neither reporting to Chennai site nor was I the facility head. Hence, it needed a lot of patient trust building and influencing from me as a leader. The few employees that belonged to the site had to be gathered to focus better on the fundamental roles. The same people had to double up for every requirement due to the unavailability of all the respective functions. This group's sustained resilience achieved the remarkable transformation that you see in the pictures. All approvals were obtained and facility qualification was also completed. Through all of this, we did realize if an organization is to succeed, it will start by doing the small things right. On the people front, we were looking to hire about 70 scientists spanning all functions at all levels. We applied different strategies for the various segments, and one of the common challenges across was that despite the Biocon brand, candidates had several questions on the structure, leadership, and vision of the new R&D site. Therefore, it was important for me to attend as many interviews to demonstrate that there is a capable leader on site and that I share the vision too. The new hires had to be subjected to level-based training, and the organogram had to be dynamically changed to accommodate the new roles. By this time, the site was part of larger meetings and forums, and I had a large responsibility of representing the site in an appropriate manner, highlighting the challenges and mustering support from all quarters to set up the functional processes. I was pleasantly surprised to know that I was nominated by the team as a wow mentor. Perhaps my inclusive leadership was inspiring to them. Projects were the exciting part of the journey, and rightly so for a scientist. As the group was newly formed, there was a high level of enthusiasm to learn and contribute. The 360-degree feedback and influence style indicator that we had undergone as part of the WomenLift Health learning modules were extremely useful and handy. This helped to inspire members to be flexible in their approach. One could choose to be a player, manager, coach, or a leader as per the situation. The scientific teams did ride through the regular product development cycle of clone selection, followed by process development, scientific advice submission, and are currently at the pilot scale consistency, looking to scale up from R&D to manufacturing in May of this year. I am proud of the team's product that is equivalent to the reference product as seen by the potency data at the bottom of the slide. The three-pronged structure of WomenLift Health Leadership Program, learnings through peers, mentors, and coaches was very helpful to perform a realistic assessment of self and also identified the areas that need mindfulness. To pay this forward, I am looking to develop other leaders. It is important that an organization has capable and engaging leaders at all levels and not just the top. This provides room for delegation, empowerment, and accountability because in this model, leaders at all levels have the strength to do what it takes to make the organization successful. Many thanks to everyone at Women Lift Health for this incredible training program, and a big shout out to all my peers in this cohort.